Hello, and welcome to this short video all about phobias for A-level psychology. We're going to explore all the things you need to know to help you ace your A-levels. Today, we're going to be talking about the different characteristics of phobias, exploring the behavioural, cognitive and emotional characteristics. Then, we're going to be talking about the different behavioural explanations of phobias, and then the behavioural approach to treating phobias. But first, what do you think you know about phobias? Some of the most common things that spring to mind might be things like a fear of heights, a fear of darkness, or something like a fear of spiders. However, the official definition of a phobia is a marked fear or anxiety about a specific object or situation. And this is according to the DSM-5, the Diagnostic Statistical Manual, which helps guide our psychological definitions. An important term to go along with this is a phobic stimulus, which is the actual situation or an object that triggers excessive fear and anxiety. Now, the Diagnostic Statistical Manual, used to categorise disorders, classes phobia as a type of anxiety disorder with three main types. There are specific, social, and agoraphobias. Now, specific phobias are phobias of an object such as an animal that are most typically associated with the idea of phobias. Whereas a social phobia is the fear of a social or public situation that causes extreme anxiety, for example, presenting in front of a large class of people. And lastly, agoraphobia is a phobia of being outside or in a public place, so often those experiencing it will not leave the house. So these are the different categories of phobias, but what about the characteristics that are exhibited when a person's experiencing a phobic response? One type of characteristic are behavioural characteristics, which is the way that people act, which in phobias often involves high levels of anxiety and fear responses. Panic is one type of behavioural response to a phobic stimulus. It may include a range of behaviours such as crying, running away, or freezing. Another example is avoidance, which is the intentional avoidance of coming into contact with the phobic stimulus, which can interfere with daily behaviour and functioning. Endurance is an alternative response to avoidance, where a sufferer remains in the presence of the stimulus with high levels of anxiety. This may be unavoidable, such as being on a plane with a fear of heights. In addition to behavioural characteristics, emotional characteristics of phobias relate to the ways in which people feel when experiencing a phobic response. Anxiety is the main emotional characteristic to remember, as phobias are a type of anxiety disorder. Anxiety itself is an unpleasant state of high arousal, which means the sufferer may find it hard to relax and makes it difficult to feel positive emotions. This is also a more long-term emotion, while the fear of a situation is more immediate. Another characteristic are emotional responses that are unreasonable. This means that reactions to phobic stimuli are disproportionate to the actual threat. For example, having an extreme response to spiders in the UK. Additionally, there are also cognitive characteristics of phobias that are related to the process of thinking, knowing, perceiving, and believing, ultimately how people process information. One of these characteristics is selective attention, where it's hard to look away from stimulus. This is a natural part of responding to something we view as a threat, as it gives the best chance of reacting quickly, but is not necessarily useful for irrational fears. Another cognitive characteristic is holding irrational beliefs in relation to a phobic stimulus. For example, those with a social phobia may think, "I must always sound intelligent," which increases the pressure on the sufferer to perform well in social situations. Another example is that people with phobias may also experience cognitive distortions, where the perception of a phobic stimulus is distorted, so they may see an everyday object in an extreme way, such as seeing a button as extremely disgusting. So now you know how the experience of how having a phobia can manifest itself. But how do phobias become phobias in the first place? The behaviourist approach in psychology focuses on observable and measurable behaviour rather than internal mental processes. It suggests that all behaviours, including emotional responses like fear, are learned through interaction with the environment. In particular, it attempts to address the behavioural characteristics of phobias that we just explored, rather than the cognitive and emotional aspects. So how does it actually explain phobias? Maurer proposed the two-process model. This proposes two stages. Firstly, Phobias are acquired through classical conditioning, and they are maintained through operant conditioning. So classical conditioning is when a neutral stimulus, something we initially have no fear of, such as a white rat, becomes associated with an unconditioned stimulus that naturally triggers a fear response, something like a loud bang. This is done by pairing the neutral stimulus and unconditioned stimulus together repeatedly until the original neutral stimulus can produce a fear response in the absence of the unconditioned stimulus. A famous example of this is Watson and Rayner's Little Albert experiment, where Albert was conditioned to fear a white rat toy despite not feeling any anxiety or hesitation towards the rat before conditioning. So that's how phobias can be acquired, but how is a fear response maintained over time? As mentioned before, it's maintained through operant conditioning. So this takes place when our behaviour is reinforced. This can be through rewards, known as positive reinforcement, or punished through negative reinforcement. Specifically, negative reinforcement is the mechanism maintaining a phobia. This occurs when an individual avoids a situation that is unpleasant, such as interacting with the phobic stimulus, preventing feelings of fear and anxiety. Since avoidance reduces distress, achieving a desirable consequence, the behaviour is reinforced and repeated. This avoidance relieves anxiety, making it more likely that they will continue to avoid rats or dogs or whatever the fear is, maintaining the phobia. But is this a good explanation behind why phobias develop? Some say that this is an incomplete explanation, as Boughton stated that evolutionary factors are also involved with the two-process model, but it doesn't account for this. For example, certain fears, like fears of snakes, we have because we naturally consider them dangerous. Therefore, maybe not everything is considered through the two-process model. Furthermore, there is an alternative explanation for avoidance behaviour, that it is due to positive feelings of safety, rather than avoiding contact with the phobic stimulus. This suggests why some agoraphobic people can leave the house with another while experiencing reduced anxiety than if they went out alone, as avoidance is not necessarily driven by anxiety reduction. Furthermore, another limitation is that there may be a genetic vulnerability for phobias. For example, Donado et al. Found that not everyone who is bitten by a dog develops a phobia of dogs, because we inherited genetic vulnerability for developing mental disorders. So if a phobia is linked to a traumatic event, this may trigger the development of a disorder in some people, but not everyone. An important benefit to take from these approaches, though, is the real application to treatment. Let's have a look at what those might be. There are two main treatments proposed by the behavioural theory. One approach is called systematic desensitization, which is a behavioural therapy designed to gradually reduce phobic anxiety through classical conditioning. This patient learns a new response to a phobic stimulus, known as counter-conditioning. There are three main components of this. The first main component is the anxiety hierarchy. This is when the therapist builds rapport with the patient to create a list of situations involving the phobic stimulus, ranked from least to most frightening. For example, someone afraid of spiders, a picture may be the least frightening, while holding a spider might be the most frightening. Another process is relaxation. Patients can be taught mental imagery techniques to imagine themselves in relaxing situations, such as on a beach, or breathing exercises to help create a state of relaxation rather than fear, as reciprocal inhibition means that both can't be experienced at the same time. The final component is all about exposure. This is when the patient is gradually exposed to the phobic stimulus while in a relaxed state, progressing through the hierarchy over multiple sessions. When the patient can remain relaxed in each step, they move up until they can face the most feared situation without anxiety. Treatment is deemed successful when the patient can stay relaxed. So this is one way of treating phobias. Let's have a look at another method of exploring phobias, known as flooding. This is a behavioural therapy that is more immediate with the exposure of the phobic stimulus. For example, having a fear of boats and having to go on a boat ride until you no longer experience a fear response. Okay, maybe that's a bit dramatic, but the general process is that flooding works through extinction. So this means that the patient cannot avoid the stimulus and eventually learns it's harmless, breaking the fear association. The patient may also become exhausted by their own fear response, reducing their anxiety. Therefore, the fear response is extinct. Flooding sessions normally last around 2 to 3 hours, but require fewer sessions and systematic desensitisation. With flooding also comes a higher emphasis on ethical considerations, as informed consent is essential, as flooding can be a highly traumatic experience. Patients are normally given the choice between the two. So now we've explored the two main treatment options. How do we weigh up the pros and cons of treatment? So firstly, Gilroy et al. In 2003 followed 42 patients with a spider phobia. They received 45-minute systematic desensitisation sessions, and results showed that even after 3 and 33 months, they remained less fearful than the control group, highlighting its long-term effectiveness. Furthermore, another advantage is that systematic desensitisation works for a wide range of people, including those who struggle with cognitive therapies, since it doesn't require deep reflection. It's an accessible and inclusive treatment for phobias. Both treatments are also cost-effective in their own ways, with systematic desensitisation having fewer dropout rates, meaning the treatment cost is more justified, and flooding requiring fewer sessions, meaning the cost is better put into session time. However, there's some limitations, with flooding not being appropriate for all phobias. Some are too complex, like social phobias, to expose someone to it in a condensed environment. Another kind of limitation is that systematic desensitisation can take a long time to complete, depending on the patient, meaning it may take a while for patients to experience reduced distress. Flooding can also be traumatic, so high dropout rates may also make it a more redundant method. Finally, there's also limited real-world application. If these treatments are done in artificial environments, meaning that they can't generalise to real-life scenarios and they neglect the potential underlying causes of phobias. So, to help sum up, what do you think you could tell me about phobias? Would it be the 3 different types of phobias we've covered today? How about the different characteristics of phobias we've explored? Maybe how phobias are maintained and how they're acquired? Or even the different 2 types of treatments of phobias, while considering the evaluations of these points. Thanks for watching. I hope you learned something today, and here are some helplines if you feel affected by anything brought up today.